Hello, it's Dr. Rhonda Johnson. Today is Sunday, March 28th, 2021. Now, COVID infections are on the rise again. So my topic today is a review of how to care for someone who is sick with COVID-19 at home, because most people will likely be cared for at home. Now, remember that people who have pre-existing conditions such as obesity or being overweight, people who are smokers, people who have chronic lung disease or asthma, folks with hypertension, heart disease, or kidney disease, or pregnant women, or sickle cell disease, or autoimmune disease, folks who have been treated for cancer. Again, I'm not listing everything, but they're at higher risk for complications. And it's always, you need to be in contact with your primary care physician if you have COVID. So again, this talk is for people who mostly can be cared for at home. So what should you have at home? What's very helpful? A thermometer so that you can keep track of the temperature. Some over-the-counter medicines for fever that can be Tylenol or ibuprofen. You want to make sure that you have plenty of fluids because hydration of the person with COVID is very important. Now that can be Gatorade, or it can be tea, or it can be juice, it can be ginger ale, it can be water, whatever they will drink. You want to have tissues and disposable utensils and paper plates, trash bags, and disposable disinfectant wipes. Some simple foods like soup or applesauce or crackers, toast, popsicle, sherbet, whatever people will eat. They might not have much of an appetite during COVID, but it's important to try to keep your nourishment and your nutritional state as well as possible. You need to have, if you're on medication, at least a 2-week supply of your prescription meds. Because again, remember, you're going to be in quarantine for 10 to 14 days, and you're likely to be sick for about 2 weeks. Now, if you can afford a Pulse Oximeter, it costs between $20 and $25. It's a little device that goes on your finger, and it helps measure your oxygen saturation in your blood. That can be real helpful for knowing how well your respiratory status is with COVID. So, okay, back to getting ready. You want to designate who's going to be the primary caregiver. And folks, that should not be somebody who is likely to have severe complications from COVID themselves as much as possible. You want to try to keep the person who is sick isolated in a room. Ideally, a room that has a window so you can open up that window. You might want to have a fan if you can. You'll need a blanket in case they have fever and chills, and a table so that you can, table and a chair for them so that they can eat in the room. If you have the ability to have a separate bathroom for the person that's sick, that will be great. You want to make sure you have enough disposable masks and cleaning supplies. You don't need any fancy cleaning supplies. Soap and water and a common household disinfectant is fine. And some disposable gloves. So again, make sure that the person who is sick is well hydrated and get some rest. You want to try to keep their pets away from them as much as possible and avoid having visitors. You want to keep them separated. I know it's a lot to be separated for 10 to 14 days, but it is possible to minimize the risk of other people in the household getting COVID if you keep that sick person separated for 10 days. And they should eat in their room and, do everything in that room, except for, of course, go to the bathroom. Now, you want to keep their eating utensils separate. Use disposable things if possible, disposable paper cups and plates and utensils. But if not, if you don't have them, then wash all their eating utensils and supplies separately with hot water and plenty of soap and water. You don't want to share any personal items, including towels or beddings or electronics. The sick person should keep their mask on when around other people. Remember that children are under 2. You don't want to use a mask, or anybody who has trouble breathing with the mask, don't, force the mask. If you're handling body fluids like stool or saliva or mucus or vomit or urine, you should wear disposable gloves and throw them out and tie up the bag right away. You want to make sure you're having good hand hygiene if you're the caregiver for someone who has COVID. And again, it's important that you keep a mask on whenever you're in contact and throughout the house as much as possible. And again, just wipe down common soap and water, high-touch surfaces. You may want to keep the bathroom extra clean. And again, you can use the same laundry. You can share laundry. Just use the hottest possible temperature for the fabric as possible. And again, you want to keep that person isolated and quarantined for 10 to 14 days as advised by your healthcare provider. It's so important to know the signs of worsening illness, trouble breathing, confusion, loss of alertness or change in someone's mental status, high fever, again, difficulty breathing, blueness of the mouth. Those are signs. But again, trust your gut, trust your instinct if you don't feel that person is getting well. Call 911 for any emergency and be sure to let them know that the person has COVID. Okay, I hope that's helpful. This is Dr. Rhonda Johnson. My views are my own. Remember, the best COVID infection is the one that never happens. Stay safe, folks. And as always, have a blessed day.